Chapter 13, Late Adulthood. Objectives. Discuss the major goals of Healthy People 2020 related to adulthood. Identify common health concerns of late adulthood. Describe challenges and developmental tasks. Discuss lifestyle changes that may be necessary for late adulthood. Discuss the relationship of physical activity to the aging process and cognition. Define elder abuse and describe means by which it can be prevented. Discuss the ways menopause may affect women in the late adulthood phase of the life cycle. List the learning needs of later adulthood. Select appropriate teaching techniques to promote effective learning and coping. These are the important key terms for Chapter 13. Late adulthood is defined as the ages between 65 and 74, and this is usually the time where most adults enter the retirement phase. Health concerns: osteoporosis, risks for falls and fractures, poor awareness of healthy behavior options, an increased risk to influenza and pneumonia, development of cataracts, increased loss of hearing. Income. For this population, they mostly rely on Social Security, pensions, personal assets, and earnings. Some, however, still live below the poverty level. It's quite a bit of this population. A lot of them require caregiver assistance. The majority of people during this age group rely on Medicare, and about half of them have private health insurance also. Challenges and problems. So this is located on page 200 and 201 of your textbook. So the first one is access to healthcare. A lot of people in this population lack transportation, or they don't know where to go for community resources. Reduced income. So the majority of people are relying on Social Security or pensions. However, it may not cover all of their daily living expenses and their healthcare expenses. So a lot of people in this group now work past retirement age, or they just live in poverty. And when it comes to work, of course, this group faces age discrimination when seeking new jobs to compensate their reduced income. Changes in living arrangements. So they might live with extended family or family members, and that's the best choice for them. However, they can live in assisted living communities, so they can maintain some independence and have social interaction. However, a lot of older adults still live in inadequate housing, or they may be institutionalized in nursing homes, and that's where they lose their independence and become more depressed. For caregiver assistance, a lot of people in this population need help with body hygiene, transferring from a bed to a chair, toileting, shopping, meal prep, and housework. For altered nutritional needs, that's due to dental problems, the inability of them to cook. They don't like to eat alone. They might have pain. They might be tired. They might have a medical condition or medication that's interfering with their diet. And for assistive devices, that would be walkers, canes, respiratory equipment, hearing aids. For preventing falls, this is very important. It can cause a lot of issues, including fractures later, and that is due to dizziness, vision or hearing issues, medications causing issues. So it's important for the healthcare worker to discuss with the older adult about their environment, maybe help them with securing loose rugs or inform other family members to help them, make sure floors aren't slippery, and then get rid of any clutter that's getting in their way. Polypharmacy. So this is where an older adult basically takes a lot of medications, and that can have an interaction. So a drug-drug interaction, drug-food interactions, or drug environment, such as the sensitivity to the sun. So it's very important to know which medications they're taking and when to take them. And also for them to go to the same pharmacy and keep their doctor abreast of any vitamins or anything else they might be taking. So most research is done on younger people and not the elderly, so we don't fully know exactly how it's going to affect the elderly person. Also, the liver and kidneys don't work as well, so they have a more difficult time excreting drugs. Also, elderly adults may forget to take medication, or they might actually forget that they took medication and take an extra dose, so that can cause an issue. Another huge issue is elder or dependent abuse. That can be physical, emotional, or financial, and a lot of that could be neglect. Those are very important to make sure that they're not experiencing any of these issues and to address these problems when they come into the office. Psychosocial development. So people in this group might face many challenges. However, if they have a positive attitude or have positive coping skills, they usually are able to live a more happier life. Some other issues they might deal with will be dental problems, issues with eyesight and hearing, decreased mobility, changes in body image. They might also end up with more health issues, and they might lose a lot of loved ones or friends, so that can cause mental distress and depression. Psychosocial issues could be any of the three. So since their friends and family are dying more and more, and they're going to more funerals and having less people to interact with, a lot of memories of those that they miss. There might be issues with autonomy, so taking care of themselves, making their own choices. Competence, do they fully understand what's going on? Are they able to talk to a physician and get what they need? Are they able to understand? And that could be involving with a hearing aid or lack of hearing, lack of eyesight when it comes to writing checks. So that's all part of competence. And then relatedness, so a sense of belonging. Do they feel like they belong anywhere? Does anyone need them? Do they have friends or a club or a church for them to join and to interact with others? Grandparenting. This is a very important process for people in later adulthood. It enhances self-image, increases activity level, and makes them feel like they are worth something and useful. So grandparents really enjoy spending time with their grandchildren. They know when they get tired, the parents will take over, so it's less stress for them, and they can be around more for fun or for structure. It's also very important for the generations to intermix. Now, when an elderly person becomes ill or disabled, that can mess with their autonomy and their competence. They might need more help in the home. They might need financial assistance, and many families aren't aware of community resources that might be available to help with these situations. So as a healthcare professional, it's very important to give them pamphlets or to get them in touch with community services. So that way the later adult doesn't feel isolated and doesn't feel like a burden on the rest of the family. Postmenopause. This is an important developmental task for the older woman. It's where women have not had menstruation for at least 1 year and is natural. And there are some risks associated with menopause: genital atrophy, facial motor instability, heart disease, breast cancer, or osteoporosis. As far as treatment goes, there's hormone replacement therapy. However, if that's not recommended due to susceptibility of blood clots, then people can use complementary and alternative medicine. So basically, complementary therapy or complementary medicine would be things like biofeedback or forms of medication or meditation or forms of relaxation that can also go hand in hand with typical medication. So maybe a person getting massages, that can be very helpful. And then when it comes to alternative medicine, that would be people using therapy and herbs and oils, natural resources. Lifestyle changes. So during menopause or being postmenopausal, there are lifestyle changes that people can adopt in order to help them adapt to the new lifestyle. That will be dressing in layers to cope with hot flashes. They can have fans available, adjustments of heat and air in the room, limit alcohol and caffeine intake, and to drink more fluids. More fluids helps with everything. As far as vaginal dryness goes, they can use water-based gels or lubricants. As far as mood swings, people can learn to manage it by being more aware of the issue and knowing beforehand how they might try and deal with it. Also having understanding family members and partners available. Herbs also help deal with depression and mood swings. And when it comes to estrogen decreasing, that can cause vaginal wall thinning and urine leakage. So it's important to have access to panty liners, pads, and adult diapers. Driving safety. So some people in later adulthood might be unaware of certain impairments that they might have, like changes in their vision or becoming dizzy or medication changes. But occupational physical therapy can help as far as their motor skills. However, if situations occur such as too many accidents, their license may be taken away and they might have to deal with alternative transportation. Now, this contributes to the lack of autonomy since they're losing the ability to drive themselves around, and they might experience isolation, loneliness, stagnation, and depression. Health screenings are extremely important. It's important to get dental and eye checkups, physical evaluation, assessment of substance abuse, over medication, sexual dysfunction, urinary incompetence, so physical assessment, pap smear, mammograms, deal with bone loss issues, and then heart issues. Sexuality. The most common cause of sexual dissatisfaction is a lack of a partner. People assume those in later adulthood don't have sexual feelings, but they still do. Men experience erectile dysfunction, or they may experience erectile dysfunction, and women may experience painful intercourse. Memory loss. Normal memory loss can be associated with aging. I also believe it's associated with the chemicals that are in our foods. However, anxiety and depression can be caused by memory loss, and it's also important to be aware and observe that this person has Alzheimer's disease. Emotional health. It's very important to stay on top of the emotional health of the later adult. They might experience disengagement since they either feel like they're a burden, they are unable to do things on their own like they used to. Also with a decrease in income and a decrease of mobility. And they also might feel like they're losing a lot of their own autonomy. They can be losing their memory. They also have lost a lot of loved ones, and they'll continue to lose loved ones the older they get and the longer that they live. So it's very important to keep abreast of the depression or disengagement, isolation, loneliness. And it's very important for people in later adulthood to keep learning, also to keep their brain in tip-top shape as much as they can. Depression. So every person in late adulthood does not experience depression. It can be circumstantial depression due to decline in health situation, like loss of a loved one. Also, they feel like a burden since they're no longer working or they don't know what to do with themselves. However, if some people in later adulthood have positive influences in their life, if they feel positive, if they feel needed, loved, wanted, if they still have interactions with people, they might not even experience depression at all. Some people get depression later on. So side effects of medication may mimic depression, so it's very important for family members to know the side effects of the medications their older family member is on. And depression can trigger physical illness, and also physical illness can trigger depression. Clinical disease. Good health in older people is often defined as an absence of disease or disability. However, people are still going to experience body changes as far as ovarian failure, aging, menopause, changes with their heart, bones, and their metabolic systems. Physical activity. So even in later adulthood, it's very important for people to still have enough physical activity. 2.5 hours of moderate to vigorous physical aerobic activity spread throughout the week is still very important. If people are used to that or accustomed to it, then they can move up to 5 hours per week. Since their body is starting to lose elasticity and lose mobility, it's very important for them to continuously engage in physical activity. It could be walking, swimming, dancing, tennis, using the bicycle. It's also important to look at the caloric intake since the resting metabolic rate decreases with age. And it's also important to strengthen the muscles, and that can help activate the metabolic rate of the body. Also, exercise can improve memory, and it can improve their emotions. Teaching techniques. So when it comes to teaching anyone, the learner should be motivated and engaged. It's also important to take into account where the person is at. So don't be judgmental if they don't understand certain things of the times, like they might not know how to use texting or certain aspects of a computer. Just be understandable and meet them where they're at. Their vision has declined, so as far as colors, they might see distortions. Medications might be affecting the color of what they see, or even their fatigue, how they feel, depression, all of that. So keep that in mind. Make sure to give them breaks so they're able to absorb all the information into short teaching sessions. And then it's also important to speak clearly and slowly and make eye contact, so that way, even though they're having hearing issues, they can kind of understand exactly what's going on still, instead of like yelling or speaking louder, because that doesn't always help if you're speaking too quickly. It's also important to use hands-on instruction so that could help them with their memory and learning. We want to make sure we encode this information into the long-term memory process instead of having it be in the short-term memory where they actually will forget what they learned. It's also very important to have mutual respect and rapport between the learner and the teacher.